Emergency. Hospitals are violating federal law by denying required care for substance use disorders in emergency departments. At the Legal Action Center, we use law and policy to build health equity for people with substance use disorders. And like much of our work, our campaign for emergency departments' adoption of evidence-based practices for people with substance use-related conditions began in response to a problem. Imagine, Taylor overdoses while using heroin. Her neighbor finds her unresponsive and calls EMS to take her to the ED. When there, staff give her more naloxone, monitor her breathing, rehydrate her, and give her medication for her withdrawal symptoms. Taylor tells the ED doctor she's overdosed many times, but once she's alert, the doctor simply discharges her with a list of local treatment programs. Later that evening, she overdoses on heroin again, and her neighbor finds her unresponsive and calls EMS. But this time, Taylor dies en route to the ED. It's important to contextualize stories like this in a broader landscape. EDs are key access points to substance use disorder care, but many do not provide evidence-based practices for SUD. And this is all occurring at a time when overdose deaths have reached an unprecedented high, and racial disparities in overdose deaths and access to care for opioid use disorder and other substance use disorders persist. We also know that stigma and stereotypes play an outsized role in the overdose crisis. As Dr. Catherine Hawk and her fellow authors wrote, stigma is often unwitting, unrecognized, and unaddressed by physicians. Providers often stereotype people who use drugs as quote-unquote undeserving of care because they view these people as folks who don't have a medical condition but instead have substance use disorders thanks to their own choices, or for whom medication for opioid use disorder is simply substituting one drug for another. But we know that stigma is dangerous. Research has found correlations between stigma and decreased provider engagement, negative patient outcomes, patient avoidance of care, and we know that people with intersecting identities often experience multiplied and amplified stigma. Relying heavily on the work of provider advocates and researchers, we identified 3 evidence-based practices for substance use disorder, all of which have been incorporated successfully into emergency departments across the country. These practices include: first, screening for and diagnosing substance use disorder; second, offering to administer buprenorphine to patients in opioid withdrawal and/or with untreated moderate or severe opioid use disorder; and third, providing a facilitated referral or warm handoff to community-based SUD treatment alongside naloxone for patients who use opioids or drugs with which opioids can be combined. LAC wants to be part of the solution, so we've brought our legal expertise to bear by identifying 4 federal laws that can act as legal hooks to require EDs to offer these practices. These include EMTALA, the Emergency Medical Treatment and Labor Act, the Americans with Disabilities Act and Rehabilitation Act, both of which prohibit disability-based discrimination and protect people who are currently using drugs from discrimination when accessing healthcare services, and finally Title VI of the Civil Rights Act of 1964, which prohibits discrimination on the basis of race or ethnicity. All of these laws are aimed at removing the harmful effects of stigma and stereotypes. As part of LAC's ongoing ED campaign, we're focused on empowering directly impacted folks and advocating with providers, hospitals, and policymakers for integration of these practices into the ED. We're empowering folks to file complaints with regulators when EDs don't offer these services. This means educating diverse communities about EDs' legal obligations for substance use-related conditions and developing helpful resources, including our Be Empowered guide for people who use drugs and alcohol, which illustrates common ways EDs can violate federal laws when they don't offer these practices, identifies actions patients can take if the ED doesn't offer these practices, and provides information on how to file complaints with regulators. We're also asking folks to share their stories of ED treatment for substance use-related conditions in response to our survey, which is linked here. And we're encouraging folks to reach out to us directly via email as well. Additionally, we're collaborating with peers to collect stories and highlight the importance of peers in reducing stigma and increasing advocacy for people who use drugs in the healthcare system. We're also advocating with ED providers, hospitals, and policymakers for ED integration of these practices, maximizing and driving momentum at all levels of government for change, and focusing on applying a health equity framework to the overdose crisis. Thank you.